New tonight, a rare case at a local hospital. Doctors believe a man's death may be linked to one of the coronavirus vaccines. Channel 11's Michelle Newell spoke to doctors about the symptoms that man showed and why they still believe the vaccine is safe.
It was an extremely rare case that doctors at Allegheny Health Network had never been presented with before.
This was, an very unfortunate, a very difficult case for the entire team.
It happened back in April. A 65-year-old man showed up to West Penn Hospital in Bloomfield.
He started to develop symptoms including headaches. He had some discomfort in his legs, and he developed shortness of breath, and that really brought him into the hospital.
The patient told doctors he received the second dose of the Moderna vaccine 10 days before the symptoms began. Doctors say the biggest symptom that made him go to the hospital was shortness of breath. They also say the patient had a history of chronic hypertension and hyperlipidemia.
And when he came into the hospital, we really diagnosed him immediately with a big clot in his lungs. And that led for us to sort of do more investigations. We also looked into his blood work, which showed a critically low platelet count. And that in combination was a very challenging situation.
Doctors say the man's symptoms met the criteria of an extremely rare blood clot disorder that had only previously been seen in some people who received the Johnson & Johnson vaccine. Doctors did all they could to treat the man, but he passed away.
So that would have been about roughly 3 weeks, I would say, after getting the second dose of the vaccine that he expired.
Doctors reported the case to the CDC, making it the first reported case in the nation of a rare blood clotting diagnosis in a patient who received the Moderna vaccine.
I believe it's very possible because we have strong evidence that he fits criteria for the VITT diagnosis, otherwise known as the TTS diagnosis. So I would say we do believe that it's a very strong possibility that he did in fact have that diagnosis, and if he did have that diagnosis, that was the likely the cause of the death.
But the doctors who are leading the case want to stress how rare this is.
We believe, and the data does support, that the benefits of the vaccine far outweigh any of the potential thrombotic complications.
The CDC says to date there has only been one confirmed case linked to this out of the 306 million doses, and based on data there is not an increased risk of getting the Moderna vaccine.